Welcome to Pinnacle Health at the Harrisburg campus. Please join us as we take you through a brief tour of your open heart surgery course. You may park in the 2nd Street garage the morning of your surgery. If you arrive before 5:30 a.m., the main doors to the hospital will be locked. There will be a security guard at the door. Just let the guard know that you are here for surgery and they will open the door for you. The lobby houses several amenities to make your experience more satisfying, including the Jazzman's Cafe, which offers a wide assortment of teas, coffees, and smoothies. The ATM for your financial convenience. The Hidden Door Cafe, where you can order homemade soups and sandwiches. And the gift shop, where you may purchase cards, small gifts, and flowers. These are the main elevators located behind the receptionist station to be used by visitors. Across from these elevators resides our non-denominational chapel. If you or your family have questions or require assistance, the information desk is conveniently located in the hospital lobby. On the morning of your surgery, please follow the center hallway to the patient registration area on the left, unless told otherwise by the hospital. As you continue down the hallway, do not take the first bank of 4 elevators on your left. Instead, continue until you see the sign for North Visitor Elevators, then turn left. Proceed to the 3rd floor. Exit the elevators on the 3rd floor and follow the signs to the surgical check-in and waiting room. Proceed to the receptionist to complete your check-in process. This is where your family can wait while you are being prepared for surgery. In this preoperative area, you will change into a hospital gown. You will be shaved, and an intravenous line will be inserted. You will also have an opportunity to speak with the anesthesiologist. You will be taken by stretcher to the operating room entrance, conveniently located on the 3rd floor, where you and your family will part. This is one of Pinnacle Health's cardiovascular operating rooms. You will be transferred from the stretcher to the operating room table and be greeted by our OR staff, who specialize in cardiovascular surgery. Pinnacle Health remains on the leading edge of technology, including robotic and hybrid procedures. The CT-ICU waiting room is where friends and/or family can wait while you are in surgery. Visitors should sign the clipboard on the desk with the appropriate information upon entering and exiting. The message board behind the desk shows updated information on your surgical process. Since no names can be placed on the screen, your family members will be given a case number in the pre-op area so that your family can follow your surgical course. This is the conference room within the CT-ICU waiting room, where the surgeon will meet with your family after surgery. The CT-ICU has 24-hour-a-day visitation, except for the times listed on this sign, which are during change of shift. It is out of privacy and respect to the patients that no visitors are permitted in the CT-ICU during that time. Please be vigilant about hand washing, especially before going into the CT-ICU. Feel free to use any hand sanitizers you see on the walls. This is the entrance and exit door to the Cardiothoracic Intensive Care Unit, or CT-ICU. The handle of the CT-ICU door does not turn, it pulls toward you. If this door is locked, it might be due to nursing change of shift report or an emergency situation is occurring with a patient in the CT-ICU. This area in the CT-ICU is called the fast track. It is for patients like you who have had open heart surgery. The reason this is called the fast track is because it is our goal open heart surgery patients to recover here within 24 to 36 hours following surgery. The typical patient will enter the CT-ICU from the operating room with a ventilator in place. This machine breathes for you until you awaken from anesthesia. Soft wrist restraints will be applied to protect you from tampering with the equipment until you are fully awake. An IV pump, chest tube setup, and monitor are several pieces of equipment we will be using for your care. You'll be instructed on how to use your PEP therapy device. This device will help to expand your lungs and prevent pneumonia. You also will receive a heart-shaped pillow, which will be used to splint your incision while coughing. After the surgery, the main elevators will be primarily the only elevators your visitors will need. If your family would like to dine at the Seven Bridges dining room on the 11th floor, the north elevators must be used. After leaving the intensive care unit, all patients will continue to recover on the cardiothoracic post-operative unit located on the 7th floor. The staff is committed to meeting your post-operative needs until you are discharged. Therefore, it is important for you to ask questions and take an active role in your care. You and your family are encouraged to attend the discharge class offered on the CTPO unit in the multipurpose room. This class is taught by a cardiovascular educator. You will also be given a binder that contains vital information regarding your health and recovery. Pinnacle